Hello, I'm Dr. Eve. Welcome to On the Couch with Dr. Eve. 3 years ago, I had a radical prostatectomy to arrest an aggressive cancer. After radiation therapy, my PSA fell dramatically, and I'm now in remission. Since having the surgery, I've been unable to obtain an erection and thought that my sex life was over. I'm 69 years old and very active. Recently, I've noticed that I have the start of an erection, but it is by no means complete and would prove difficult to penetrate my partner, which is pretty frustrating for me and for her. Thinking that I might be recovering from my erectile dysfunction, I made use of a vibrator. On applying the device to the side of my penis, I experienced an orgasm for the first time in 3 years. I must add that this experience was not without visual stimulation from porn sites, which I'm not sure is legal and makes me feel guilty using this form of masturbation. Is it legal? Can I be arrested for using these porn sites? Will a better vibrator help the process? And how does a male make use of it? Do you know others who've been in similar situations to me and have recovered from erectile dysfunction? Is there any medication to assess the situation? If so, what? Many things come up for me as I read this letter. I think one of them is a sense of anger and despair that healthcare providers are not providing healthcare adequately for men in these kinds of situations. It is unquestionable, it is unconscionable that a man can go through a radical prostatectomy and not be told by his doctor that he may have erectile dysfunction and of course difficulty with ejaculation as well. Of course you are going to have erectile dysfunction. Of course your healthcare provider should be talking to you about the many, not only medications, but other factors that are involved which would help you to get an erection again. By the way, watching porn is not illegal. We live in a democratic, free world, and the internet is accessible to everyone. So there's not going to be a policeman knocking on your door and saying to you, why are you watching porn? So you can go ahead and do that if you are doing it within an elegant manner that doesn't impact on your relationship. So let's get back to your erectile dysfunction and your radical prostatectomy. It is very regular that after about 2 years, without any treatment, you will begin to recover some of your erectile functioning again. I think you're amazing that you've waited two years to wait for an erection, when in fact what could have happened, should have happened, and can now still happen, is that you visit your urologist and you ask him to consider you as a candidate for a PD5 inhibitor. PD5 inhibitor is either Viagra, Cialis, or Levitra, which is what's available in South Africa. And they do absolute wonders for getting men to have very good erections once, as I say, you have been considered a good candidate for taking this kind of drug. It will create the world of difference for you. If you find that you cannot take a PD5 inhibitor, that your doctor does not recommend it, there are other medications that you can take that are guaranteed to give you an erection, such as injection therapy. So, one of the things you could start doing now, before you go off to your doctor, is make use of a cock ring. Now, a cock ring is going to just roll down to the very base of your penis. Do it when you have an erection, and it will make sure the blood is trapped into that erection, and you'll be able to sustain your erection for a little longer than usual. Visit my site, dreve.co.za, and get some more information on cock rings and other necessary objects you could be